Thank you. Thank you so much for joining me today here at what I hope will be an opportunity to change the conversation about a controversial issue that's plagued this nation in trying to make decisions over the course of the last 10 years. We believe that the initiative that you're going to hear about today and that we're launching today is going to be a conversation changer not only here in Sacramento, not only here in the state of California, but we believe nationwide, and then we hope worldwide. A lot of you don't know this about me, or maybe you do know this about me, that I have been a daily medical cannabis user for the last 10 years. I'm probably one of the only celebrities in this country who stepped up early on and admitted to my use, and the reason why I do so is because, I suffer from MS, and most people know that, but in some of my symptoms of MS, the worst being my neuropathic pain, second being spasticity and cramping, I sought out, since my diagnosis initially, majority prescription medication to try to see if I could assuage some of those symptoms. And then after a course of about a year and a half of true drug abuse, and the first time I abused drugs in my life because I overused prescription medication to the point that it was no longer effective, I sought medicinal marijuana or medicinal cannabis and included that in my arsenal as one of the tools that I use to battle my illness. But I want to make sure you understand very clearly, I still take approximately $2,500 worth of prescription medication every single month. I stick in anywhere from 2 to 3 needles in my body a day. Certain days of the week I don't have to take all 3. And so medicinal cannabis has been another weapon in the arsenal and in the quiver that my doctors can use to help me live what we hope is a relatively normal life. Today is about listening. It's not about your listening. The reason why this facility is open is because I've been listening. I've gone all over this country in the last 10 years. I put my neck out, stepped out in front of everyone and told them I believe that cannabis should be made available to all patients in a safe and efficacious way. But unfortunately, the lobbying that I've done all over this country, I feel in some of the areas, has been hijacked by some people who really don't give, and I'm going to use the term, and I'm sorry, don't give a damn about patients. They've been in this for another reason. And what I'm trying to do here today is trying to wake us all up to recognize that a new day's here, a facility's here that's going to re-establish what this entire movement began with. That's putting the patient first. And so in the listening, we understand that one of the issues that a lot of patients have been fearful of in coming to a facility like this is because of, number one, safety, just safety. Getting out of a car and walking in the door of some of the facilities that are here, and though they were started and built by some very good meaning people, we got caught up in a culture that really literally is getting ready to destroy the need for this as medication. The culture is one that is trying to attract people to, if you will, the ideas of medical cannabis of yesterday. And what we're trying to do is set up a model that will create an environment for patients to understand that there is a new dawn for this medication. It's not all about me. It's all about, like I said, listening to the patient, listening to what they have to say when they come in here, listening to what they say about the medication that we've given them, and listening to what they say about what they would like to see in the medication, and then incorporating that in the program that we're trying our best to advise this dispensary on how to administer. I'm making this announcement here in Sacramento for a specific reason, and here in California for a specific reason. This is where the movement started. And as I've gone around this country to places like Delaware, where I just most recently met with the governor of Delaware and was instrumental, I believe, in helping them pass their most recent medicinal cannabis law. And I've met with people around the country, most of them refer back to California. And in some areas of the country, they don't necessarily look at what's going on here in the greatest light. But a lot of them are looking at what's going on here to see if maybe, just like in the beginning, California set a standard, they're waiting for a new standard to be set And that standard is one that we're trying to set here through advising the Abate and Wellness Collective to help them create, again, a new standard in patient care and safety. And as we, again, listen to that feedback, what we're going to do is make sure that the patient is included in the protocols that we establish so that, contrary or different than other facilities that are caught up in the battle and the argument and the war on whether or not this should even exist, what people are forgetting is that while the war is going on, the collateral damage is the patient, and we're leaving those patients on the battlefield. And we're right now trying our best to get them off the battlefield and give them an opportunity that they can walk into a facility, understand that the people that are running this facility have a new philosophy, and that philosophy is not to be here to dispense drugs, but to be here to help you work through your issues with your illness. And so our format, the way this collective is established, the way this dispensary is established, is different than any one that you will see anywhere in the country. And it's not just because of the marble and the glass and the television screens, but it's because of the entire philosophy from A to Z. And when a patient walks in here, they're not only coming in to receive their allotment of medication, but we believe that they're coming in here to be educated. They're coming in here so they can feel comfortable. And so to make them feel comfortable, we're going to be providing them with more information and more guidance than I believe any facility in this country has ever attempted to do. And in establishing these protocols, what we're trying our best to do, and what we will do, not what we're trying our best to do, we are doing 100% and trying to do it at the 200% level. And as we are adhering to the letter of the law in this local municipality in Sacramento, the state law, and as we move this across the country, we will adhere to every law that's in place before we walk in the door. In order to help me do this, I've assembled a team of advisors and experts to help me make sure that the advice that I'm giving out to the dispensaries and collectives that we're working with is, number one, the most cutting edge, number two, the most advanced, based on science and based on expert opinions. And I've asked two of our advisors to be here with me today. And please, gentlemen, come on up and step with me, because I'd really like to introduce them to you. One is Dr. Alan Shackelford, who's a graduate of the University of Heidelberg School of Medicine, 7 years of postgraduate training in clinical medicine research at Harvard Medical School, physician member of the Colorado Department of Revenue Medical Advisory Work Group, and also joining me is Mr. Michael Backus, who his work has been focused on, over the course of the last 10 years of your life or longer, has focused on cannabinoid medicines, the next generation of medical cannabis and emerging delivery technologies. He will also lead our team along with Dr. Mark Lewis, who's a natural products chemist, whose previous work also focused on anti-tumor medication. And we have a list of other advisors who could not be here today, unfortunately. They're traveling around the world, who are all involved in doing one thing, and that is putting together a protocol that remembers why this all began, and that remembers that we need to put the patient first. And if we're going to do that, then we need to bring this into this century and make sure that our patients feel as comfortable as they are with the medication that they get. I'm going to ask Dr. Shackelford to please say a few words.
Thank you, Montel.
Thank you.
I am very excited to be assisting Montel in raising the standard of care for medical cannabis patients everywhere. Now, as a clinician involved in this field, I'm very familiar with the medical literature that supports the use of cannabis as a treatment, and I also support the position of the U.S. government as stated in their application to patent the components of cannabis and its medical efficacy, as well as the entry that was made in the National Cancer Institute treatment database. One of the central elements in Montel's vision has been to reach out to physicians with programs in continuing medical education and other information that will help them feel much more comfortable in recommending cannabis to their patients as a viable and appropriate treatment option based on objective medical evidence. And I could not be happier and more excited to be a part of this project.
Thank you, sir.
Thank you.
Mike, thank you, sir.
Thanks. A key element of Montel's vision is simply embracing an evidence-based approach to medical cannabis. Too often in the United States, in the last 70 years, we've seen real research put aside for basically political expediency. And what we want to bring with Abatin is a vision of medical cannabis that looks to science at every single step so that we can provide patients with the kind of safe medication and safe access that they've so long needed. To achieve that, we're going to build a database. We're going to build a database that looks at the different strains and varieties of cannabis and their constituents, and we will work with our patients to understand how they help abate symptoms. And that's what abatement is about. We intend to earn the confidence of patients through science and the collection of evidence that we get from our membership and share back with our membership to raise the level of the conversation about medical cannabis in the United States, in Sacramento, and for our own membership. Thank you.
This is just a cursory overview. And of course, we're going to have an opportunity to sit down with a lot of you individually and have some interviews to give you some more information. But I think what both Mike and Dr. Allen had to say is that this is a science-based initiative. Everything we're going to attempt to do is going to be steeped in science, validated by science, and then interpreted for the patient so that the patient can also educate themselves at a level to understand that this is not about bringing people in here and trying to persuade them to use medical cannabis for the rest of their life. This is about looking at the individual and helping them discern a course of action that's best for them. Let me explain something to you, the reason why I'm so adamant about starting this. I began in this journey with cannabis because it was recommended to me by a doctor. But he just said, try cannabis. No direction, try it. So 2 or 3 years of chasing product that didn't have carcinogens in it, like butane and other things that could do nothing but exacerbate an illness like mine. I started doing the research myself, and I started digging more and more and more into it. I look back now at my journey with medical cannabis. I wish I had known these guys the day I started this journey, because they would have stopped. Sorry. 9 years of my over-medicating. When I started on this journey with medicinal cannabis, I was using more than I really even needed to. As a matter of fact, I was using so much that it probably wasn't effective. What we're trying to do is not create more users. We're trying to help you understand that this can be managed at the smallest level. Since my beginning in this process, I am now utilizing 90% less cannabis a day than I did 9 years ago. 90%. Fact, some days I utilize 95% less than I utilized 9 years ago. This is what I'm attempting to do, and we're attempting to do for all cannabis patients. There's no reason for us to even be discussing this medication in the language of yesterday. And so what you're going to find here is that this entire conversation is going to change from A to Z, from what the medication is called, to the way the medication is packaged, to the way the medication is formulated, to the way the medication is dispensed, to the way we interact with patients, to the way that patients understand what's available to them. That's the objective, and I want to thank you all for being here.